the hell can we have 257 gangs in this country? How could that be? How the hell can we have another 41 gangs added to the 257 that is on the verge of becoming gangs? How can we have that? How can we have 50 conflict that is going on for years and months and weeks and a few days that is costing the lives of thousands of our citizens?
Police statistics have confirmed that 11 persons were shot, 5 fatally, during attacks by gunmen in Kingston and St. James last night. In Kingston, 2 vendors were killed at Coronation Market. They've been identified as 34-year-old Dane McDonald of Fitzgerald Avenue, Kingston 13, and 54-year-old Sonia Bennett of Christopher Road, Kingston 14. A man was shot and injured. Persons reported hearing explosions shortly before 10 o'clock and contacted the Darling Street Police. The injured persons were taken to hospital, where Miss Bennett and Mr. McDonald were pronounced dead. Meanwhile, gunmen struck on Metcalf Street in Denhamtown, Kingston last night, leaving an auto body repairman Rupert Grant dead and another man injured. About 8:50, the men were standing along the road when a white Nissan AD wagon drove up. Now, the occupants of the car came out and opened fire, hitting them. They were taken to hospital, where Mr. Grant was pronounced dead. The other man was admitted in stable condition. Over in St. James, 6 persons were shot, 2 fatally last night when gunmen opened fire in Providence Heights. The shooting happened along Nasberry Place sometime after 8 o'clock when a group was playing dominoes outside a house. Residents say an armed man approached the group and started shooting. Persons ran toward a nearby shop trying to escape when 2 other men also started shooting at them. The injured persons were rushed to hospital, where 2 were pronounced dead. The 2 have been identified as O'Neill Gibbs, a laborer, and Tevin Campbell, a carpenter, 25 years old. Their grief-stricken mothers say their sons were good citizens.
Tevin no trouble nobody. Me don't know if Tevin and nobody up here not nothing at all. Tevin and everybody up here friend. Everybody friend, see all my neighbors, everybody friend. Tevin, I don't know. A cigarette Tevin go by. Tevin caught up in the shooting.
I didn't expect this. When I hear saying get shot, I figure more or less I go past I'll go see. I wait for him to come in yard. When I reach out to me saying dead, I'll know me in a disbelief. Because I don't know if they talk to people that's then just going to kill it or so. I don't know where this they come from. I just have to tell myself that in that the wrong place at the wrong time.
And as the number of killings continue to rise, one resident says she's tired of the continuous killing in the community and is demanding that something be done.
Right now, I feel say we need justice, and the only justice I see we're going to stop them killing here is hanging. And I feel say hanging to come in because I be a young picnic, I take up guns, supposed to hear the shot them, I'll picnic in the lane and play picnic with none of we can't picnic them, can't come out complain on at all now, you know. And if you know, so we innocent, we have a picnic them innocent and dead. I can't take that something no more, I can't take it no more.
And still on the crime scene, one person is in hospital following a shooting at the Mapen bus park in Clarendon on Tuesday night. It's reported that about 7:15 p.m., gunmen opened fire at the bus park. A vendor was shot. The vendor was rushed to hospital, where he's still treating gunshot wounds. Meanwhile, a medical professional attached to the Kingston Public Hospital, KPH, is concerned about the effect the bloodletting across the nation continues to have on the country's health services. Addressing yesterday's meeting of the Joint Select Committee of Parliament, reviewing the Zones of Special Operations Act, consultant anesthetist at the KPH, Dr. Ann Gibson, that's Dr. Ann Jackson Gibson, says the treatment of numerous gunshot and stab wound victims has been stifling the hospital's capacity to perform operations on other patients.
Cancers that need to be done, because the emergencies are taking away not just time but resources from these. For 2016, we had 724 gunshot wounds that survived A&E. We had 207 that were dead on arrival. We had 335 stab wounds. This is just KPH. and we had 21 stab wounds that were dead on arrival. The total therefore ended up to be 1,059 that ended up going to the wards. So you have 1,059 persons that are occupying beds on the wards that we need to put elective cases in, and a lot of these people going to the operating theatre.
Meanwhile, Dr. Jackson Gibson says the hospital's intensive care unit ICU continues to be overwhelmed by the large volume of gunshot victims. She says for January to June 20 this year, there have been 28 admissions to the hospital's ICU for gunshot wounds. Dr. Jackson Gibson estimates that the KPH has spent close to $80 million so far to treat these emergency patients.